On this Tuesday night, Ontario's Premier hints at more restrictions. Is a tougher crackdown coming, and when?
When you have an inferno, you have to turn the hoses there.
As variants continue to rise across Canada and pressure piles on to vaccinate more Canadians faster. No quarantines, no mandatory COVID tests, no problem.
This is an important step forward.
A new travel bubble between Australia and New Zealand. And SOS, the perilous rescue in rough waters off Norway.
Global National with Donna Friesen.
Good evening and thanks for joining us. We begin tonight in Alberta, where Premier Jason Kenney has moved the entire province back to phase 1 of the public health restrictions, an acknowledgement the restrictions that were in place are not working. Case counts, including the variants, are on the rise there, as are admissions to intensive care. As of midnight tonight, all indoor social gatherings are banned except for worship services. Retail stores can stay open but must reduce their capacity to 15%. In-person dining is banned, though that doesn't take effect until Friday. Heather Yourex-West is in Calgary. Heather, is this what medical experts in Alberta were hoping for?
No, Donna, it's not the sweeping circuit breaker type lockdown that many doctors had been calling for. When restrictions take full effect on Friday, you'll still, for example, be able to hit a patio or go to the mall. There are new restrictions that are coming into effect, as you mentioned. The question is, will they be enough?
The mayor of Edson, Alberta, is angry.
It was in my community, and I had no idea.
Kevin Zahara says he learned from media reports Monday that the P1 variant was spreading in his community. Earlier in the day, the province revealed via Twitter that a returning traveler had spread the virus to 3 work sites in the province. Global News later confirmed those sites belonged to PTW Energy Services and involved sites in Drayton Valley, Hinton, and Edson.
It's unfortunate that that information isn't being shared with Albertans, that it's not forthcoming, because I think Albertans are smart enough to make really important decisions if they have the information available to them.
The P1 outbreaks, including an unrelated outbreak at a workplace in Calgary, means the more highly transmissible variant cases will only continue to rise.
With between 800 and 1,000 new cases a day. And if it's going to double in a week, as our modeling shows, we'll be at 1,600 to 2,000 cases.
To be blunt, this wave is here. These trends would threaten the maximum capacity of our healthcare system by next month, right when we're reaching critical mass of vaccination.
It's why the Alberta government is putting new restrictions in place, but stopping short of a full lockdown. Starting Friday at noon, indoor dining is no longer permitted, but outdoor patios will still be allowed. Group fitness classes are cancelled, but one-on-one personal training can continue.
These variants are a real enemy of public health and of lives. And tired though we may be, we cannot stop now. We must defeat these variants.
Daily case counts currently compare with the situation Alberta faced in mid-November. But in Wave 2, the province didn't implement full restrictions until numbers doubled in early December. This time around, with variant cases, Alberta hospitals are already feeling the strain.
We can't put wild-type COVID patients with variant patients together. So that effectively reduces our hospital capacity in the COVID wards upstairs. And that trickles down to the emergency department.
The new restrictions won't have an immediate impact. For the next several weeks, hospitals will see COVID patient numbers rise. But if these measures are successful, the curve will begin to bend in 10 days to 2 weeks' time.
Now, an important point to remember is that these variants are very easily spread. And what other countries have seen, measures that have worked in the past in previous waves may not be as effective this time around. So with these measures still allowing for some gatherings, even though it's outside, it remains to be seen if they will go far enough. Donna?
All right, Heather Yourex-West in Calgary, thanks. It is becoming clear how this new phase of the pandemic, driven by those fast-spreading variants, is changing the game in Canada. Over 15,000 cases of variants of concern have now been reported. The B117 strain, first identified in the UK, accounts for over 90% of them. Cases of the P1 variant, first detected in Brazil, jumped from about 460 a week ago to over 857 this week. And younger people are getting sick and ending up in critical care. Ontario reported over 3,000 new cases today. 63% are variants of concern, and a record number of people there are now in intensive care, 510, up from 387 last week. Toronto isn't waiting for the province to act. It is sending students back to remote learning. So are Peel Region and Guelph. A number of public health officers and ICU doctors are asking for a strict stay-at-home order in Ontario. Premier Doug Ford isn't ready to do that yet.
This is moving day by day, by hour. We're going to have further restrictions moving forward very, very quickly.
If there is one thing we have learned in the last year, it is that hesitation and half measures allow the virus to win. Eric Sorensen reports.
If Toronto is the country's COVID hotspot, then a scene like this makes no sense. People clustering in malls, shopping for non-essentials.
It was absolutely jam-packed, and I truly was hoping that, people wouldn't be going in there.
Ontario's premier, feeling besieged amid demands that he do more with vaccines and lockdowns, suggested further restrictions are coming for areas like Toronto.
When you have an inferno going on somewhere, you have to turn the hoses there.
In fact, school boards in Toronto, the largest in the country, will shut down to in-person teaching tomorrow and go to online learning. At least 2 other school boards are also moving online. It didn't happen fast enough for one COVID biostatistician who already took his child out of school.
My 12-year-old son is learning from home. He was learning from home last week. Right now, we have a lockdown that is noticeably weaker than the January one, and yet we're dealing with a variant which is a lot more transmissible.
COVID variants now make up the majority of cases in Ontario. In Toronto alone, there are more than 160 active COVID outbreaks. The largest number in schools, where there are more than 50 outbreaks. Another 35 in childcare centres. And there are 47 outbreaks in community and workplace settings, including offices, factories, and grocery stores. Many are young, essential workers who are getting sick but won't qualify for vaccines for several more weeks.
I'm definitely seeing people coming from these workplaces that are essentially high density, they're essential, and many of the people that I'm seeing are infecting, unfortunately, household members.
In Ontario, the curves are troubling. Hospitalizations have turned sharply higher again, and the number of deaths has also been bending upward once more. The Ontario Medical Association says what's needed right now is a more stringent government stay-at-home order.
And what that means, I know no one wants to hear it, is that people should only leave their homes for essential businesses, medical appointments, groceries, those kinds of things.
Medical officers of health in Toronto, Peel and Ottawa have specifically chimed in for stay-at-home orders, and provincial public health officials are signaling that new restrictions could come as early as tomorrow in the hot zones that are asking for them. Eric Sorensen, Global News, Toronto.
Quebec has announced more restrictions for Montreal and other regions in the red zone. Beginning on Thursday, all fitness centers and gyms, which have been a significant source of the spread, will be closed. And starting Monday, the province will move high school students to a mix of in-class and online learning. BC has reported more than 200 new cases of variants today, though there's a lag in testing, so the real number is likely higher. The province's top doctor says while there is a lot of focus on the P1 strain, it is the B117 strain that is dominating in BC now, and there are other mutations to keep an eye on.
We also have the P2, which is another strain that is causing a lot of illness in Brazil, and it's slightly different from the P1 that we're seeing here. So what we can tell is there's a whole landscape of these different viruses and different variants that we're following, and we see that some of them can really take off.
There is growing recognition the age-based vaccination strategy needs to be modified to include younger essential workers. As Abigail Bimman reports, the federal government is under intense pressure to get more vaccines into the country faster.
It was the Prime Minister's first address in a week that saw climbing COVID-19 cases and an 18% increase of people in ICUs.
COVID-19 isn't done with us yet, and that means we all have to hold tight a little longer.
Justin Trudeau said he's speaking to Ontario Premier Doug Ford Tuesday and all premiers Wednesday.
And if anyone needs extra help, the federal government will be there.
Facing criticism over Canada's bleak vaccination rate, his health minister tweeted a thread showing 10 million vaccines have been delivered nationally. 35% sit in freezers, 1.5 million of those in Ontario.
We just got those. We literally got them a few days ago.
Questioned repeatedly, Patty Haidu refused to say if she felt the rollout was too slow, stressing she was just trying to provide clear facts.
We've heard all along that it's confusing, that numbers are, flying out of a variety of different sources.
And you can prevent more deaths and more hospitalizations and more infections by focusing on and prioritizing those people who are at risk of exposure.
As vaccination rates inch up, there's concern essential workers aren't getting them fast enough.
By the end of the week, those aged 40 to 59 who are frontline workers who are interacting in person with the public and who cannot work virtually will be able to start booking their appointments.
BC had a plan to prioritize essential workers, now forced to retool after the advice not to give the AstraZeneca vaccine to those under 55. The biggest problem is still in Ontario. Dr. Zane Chagla says the infection rate is 2.5 times higher in some neighborhoods there, home to more essential workers.
Uncontrolled community transmission is leading to hospitalizations, is leading to scarce ICU resources, is really leading to that healthcare apocalypse that we thought was going to happen at the very beginning of this pandemic.
A year later, in round 3, the alarm bells keep ringing. Abigail Bimman, Global News, Ottawa. As Canada vaccinates tens of thousands of people each day, the U.S. is immunizing Americans by the millions every day. And today, President Joe Biden said every adult will be eligible for a vaccine by mid-April. Jackson Proskow reports on America's accelerated vaccine strategy.
In the U.S., the newly vaccinated keep getting younger. In Wisconsin, every adult is now eligible. 18-year-old Ella Wareham is thrilled.
I play sports, so I'm really excited to be able to play against other teams and maybe have concerts come back and stuff.
What's happening here will soon happen across the U.S. as President Joe Biden directs states to open up eligibility to all adults weeks ahead of schedule.
We've vaccinated more people than any other nation on earth.
You're done. You are fully vaccinated.
40% of adults have had at least their first shot. Vaccination is happening at a rate 5 times faster than the global average.
If you were still living in Canada, would you have qualified for a vaccine?
No, definitely not.
36-year-old Canadian Chris Bowman, who lives in Denver, was able to take advantage of that ample supply. Like many Canadians in the U.S., he was immunized weeks before his parents back home.
Part of the reason why I tried so hard to accelerate my ability to do it is so that I can come back and visit family. But there was a sense of guilt at the same time.
Just like in Canada, the U.S. also faces the threat of a virus resurgence. Cases are spiking in 20 states as the B117 variant, first detected in the UK, becomes dominant.
It definitely feels like deja vu all over again, but again, we know what to do.
Yet some Americans are just as quickly letting down their guard. From packed stadiums in Texas to California, which says it could fully reopen by mid-June.
We're in a race between vaccines and variants, and eventually the vaccines are going to win, but in the interim period, we still have a lot of opportunity for spread.
The pandemic may not be over, but in the virus-ravaged U.S., the end is finally in sight. Jackson Proskow, Global News, Washington.
A mea culpa at the investigation into misconduct within Canada's military. Coming up, why the country's former top civil servant is saying sorry. More developments in the investigation into former Chief of the Defense Staff General Jonathan Vance today. The country's former top civil servant, testifying at the National Defense Committee, apologized for the way allegations against Vance were handled. Our Ottawa Bureau Chief Mercedes Stevenson is with me. Mercedes, what did Michael Wernick say?
Well, Donna, it's not often that there are apologies from senior government officials, and in this particular incident, the Prime Minister and the Defense Minister have not apologized or really said that a lot more should have been done in the wake of the allegations against former Chief of the Defense Staff, General Jonathan Vance. But today, Canada's former top bureaucrat, Michael Wernick, did do just that. He acknowledged that more could have been done for the victims and that misconduct in the forces might have been stopped earlier if more action was taken. Instead, politicians and bureaucrats, he said, became sidetracked with other issues, including a coming election.
I think collectively the system failed, and it let down the complainant, and it let down the women and men of the armed forces. And I deeply regret that. In fact, I would like to apologize to them if my decisions or decisions not to do something prolong this. I'm sincerely apologize to the men and women of the forces for that.
Wernick said that he and Minister Sajjan did speak directly about John Vance's performance, and whether or not he should stay on longer, and that there were other concerns about things happening in the military, including the high rate of turnover with senior officers and Vance's desire to stay on apparently until up to 2022. But none of this seems to have come along with more discussion about those allegations against John Vance.
Mercedes, we also heard from the defense minister about whether further investigation by him would have amounted to political interference. Where does that issue stand?
Well, Sajjan continued to defend his response of not accepting that envelope with evidence, but today Michael Wernick had a different opinion. Listen to this.
He had the alternative of accepting the envelope and immediately giving it to somebody to send over to us. He could have acted as the courier and said, okay, I'll take it from you, but I'm sending it to PCO. And I do think that Mr. Walburn could have found some redacted version of the information to give to us that might have hypothetically given us more to go on.
Wernick says if they had had that envelope, perhaps they might have been able to do more. But in a forward look, Donna, he says the military culture must change.
All right, Mercedes Stevenson in Ottawa, thank you. A daring rescue at sea still ahead. Why the crew of this vessel had to abandon ship. A risky rescue in the North Sea on Monday. A Dutch cargo ship lost power and began to list. Fearing it would capsize, some of the crew abandoned ship. They jumped into waves that were up to 15 meters high. All 12 were safely picked up by a Norwegian rescue team. The ship is still adrift about 74 kilometers off Norway's coast. It's at risk of sinking and causing an oil spill. Crews are now mobilizing to try to figure out a way to stabilize it. Iran says it has indicted 10 officials in connection with the downing of that Ukrainian passenger jet. 176 people on board were killed, including dozens of people bound for Canada. None of the officials has been named, and it's unclear their specific connection to the strike. Ukrainian Airlines Flight 752 was struck by 2 missiles minutes after taking off from Tehran in January 2020. The Iranian government blamed human error in its final report released last month, saying the plane was misidentified as a hostile target. The Canadian government condemned those findings, and Prime Minister Justin Trudeau vows to keep pressure on Iran to cooperate with a full investigation.
The lack of a full and total investigation means that Canada, along with our fellow countries in the International Contact Group, will continue to put pressure on Iran to deliver true accountability and justice, compensation for the families.
85 Canadian citizens and permanent residents were killed. 53 other people were also headed to this country. Jailed Russian opposition leader Alexei Navalny has been moved to a sick ward and has been tested for COVID-19 because of his declining health. Navalny says he is suffering from a bad cough and high fever and claims there has been a tuberculosis outbreak among his cellmates. Navalny's personal doctor, who was turned away from seeing him today, says the care he has been receiving poses a lethal risk to his health. She and nearly a dozen other supporters were arrested today at a demonstration outside his prison camp. Navalny, who is serving a 2.5-year sentence, is nearly a week into a hunger strike, demanding access to proper care for acute back and leg pain. Prison officials say his condition is satisfactory, and they claim he's getting all the help he needs. The pandemic has brought economic uncertainty to many, but it's been a great year for billionaires. Forbes' 35th annual list of the world's richest people shows there are now 2,755 billionaires. That is the highest count on record. 493 are newcomers. That means a new billionaire was minted roughly every 17 hours. Amazon's Jeff Bezos topped the list for a 4th year running. Altogether, this year's list is worth $8 trillion more than the 2020 list. Hard to get your head around that. Quarantine-free travel next, the bubble plan for 2 countries with COVID-0 strategies. What's become clear in the last year is that countries which closed themselves off and adopted a zero COVID strategy are far ahead of the rest of the world. New Zealand and Australia have kept illnesses and deaths to a minimum, and now they're showing what's possible when you eliminate cases of COVID-19, not just flatten the curve. Redmond Shannon explains.
At the start of the pandemic, New Zealand locked down fast and hard. The result, a country operating almost as normal, with only 4 COVID deaths since May. And now Prime Minister Jacinda Ardern has announced a new step towards normalcy.
I can confirm that quarantine-free travel between New Zealand and Australia will commence in just under 2 weeks' time.
For the past 6 months, Australians have been welcoming travellers from New Zealand without quarantine. Now, with community transmission almost eliminated in Australia too, the favour can be returned.
We have ensured that both our countries have been, despite dealing with the virus, have not suffered the same types of virus impacts that we've seen in so many other countries around the world.
That's because the colonial cousins both adopted a zero COVID strategy, building on already strong border controls, with quarantine hotels from early on and short, sharp circuit breaker lockdowns when a new case emerged. The effort has paid off.
I know families, friends and significant parts of our economy will welcome it, as I know I certainly do.
Many Australians are eager to jump on a plane across the Tasman Sea.
Absolutely out of this world. My 3 grandchildren are living in New Zealand.
It's a bit of a rainbow at the end of this long process it's been.
The bubble begins on April 19th. The same day as Canada's Atlantic travel bubble resumes. Ardern has stressed that any resurgence in cases could see the arrangement suspended. Redmond Shannon, Global News, London.
And that is Global National for this Tuesday. I'm Donna Friesen. Tonight's Air Canada is Winnie the dog admiring the sunset in Calgary. We are told Winnie is a big fan of Global National, and we are choosing to take that as a compliment rather than thinking we're going to the dogs. So woof woof to you, Winnie. Thanks for watching, and I hope to see you here again tomorrow. Take care of yourselves. Bye-bye.